Hi, I'm David Kester. I'm a health services researcher and palliative care physician at Duke University, where I'm the chief of palliative care, and where I also direct the Duke Center for Palliative Care. And I'm delighted to tell you about a collaborative project with Counterforce Health, which we envision as a platform that will change the way that patients with chronic serious illnesses interact with insurance companies, and specifically ways that we can help patients to appeal insurance denials. These insurance denials are becoming rapidly a public health crisis. In the US alone, there are more than 50 million denial letters issued annually. And although about half of those denials can be overturned, only a small minority of patients even try to appeal. And we know that those patients who don't bother to appeal those letters have worse health outcomes and less trust in the health system. What's the solution? We've wrestled with this a lot, and I wrestle with it every day in clinical practice. And ideally, we'd look for insurance reform or value-based care or improved pricing transparency. But we began to ask ourselves about a year ago, what could we do now? What could we do by next Tuesday to help our patients in need? And started thinking about what we could accomplish if we empowered patients by giving them the tools that they need to create accurate, effective insurance appeals, increasing that 0.2% of patients who appeal to ideally 100% or close. And my guiding star in helping to create this work with our colleagues at Counterforce Health is my mother's story. When she was diagnosed with multiple myeloma in 2018, she and her husband, my stepfather, faced countless insurance denials. But I think what the insurance companies didn't realize and didn't reckon with is that both my mother had a PhD in toxicology, my stepfather has a PhD in biomedical engineering. Between the two of them, they had tens of millions of dollars in career funding from NIH and NSF, and those insurance never had a chance. They didn't know what hit them. And so the question I always ask myself is, how do we give everybody the skills that my mom and my stepfather have? How do we give everybody the skills to be an insurance appeal black belt? And that's where Counterforce Health comes in. It's a platform that anybody can use for free to generate effective, compelling appeal letters. Counterforce Health is an AI-powered insurance appeal tool. It ingests a denial letter, prompts patients to incorporate other supporting documentation, creates a response, and then coaches next steps. And some of the future functionality we're working on is a telephonic version, and actually beginning to automate some of this process to take even more of the burden off of patients who, when they're facing chronic illness, already are burdened quite enough. The technology we use is large language models that rely on ChatGPT interface, a vector database, temporal workflow orchestration, which keeps the human in the loop, which in this case is the patient, and then a web app distinct for patients and providers. The current state, we have a working prototype. It's in use in more than 25 clinics around the country, and anecdotally, we have success rates of about 50%. For this pilot, our overall goal is to evaluate and optimize Counterforce's ability to craft successful insurance appeals. We're using patient-clinician recruitment within Duke Health, and then a secondary analysis of all the Counterforce database of denials and appeals that we have going on nationwide. In AIM-1, we'll really focus on optimizing the accuracy and the tone of those letters with review by expert clinicians. In AIM-2, we'll focus on usability testing to make sure this is usable, feasible, and simple and engaging to use with at least 20 patients, with more if needed to optimize its usability. And last but not least, we'll look at effectiveness in real-world applications across a variety of conditions, including both medications and interventions, surgical procedures, looking carefully at what our success rates are, and then going back to AIM-1 and AIM-2 to see what we could do to improve that. In the future, looking forward to expanding and scaling and partnering with nonprofits and health systems, developing both strategic partnerships and strategic investments. So I'd encourage you to take a look. Website is counterforcehealth.org. Check it out, try it out, and please give us feedback, suggestions, ideas. If there's anything you see we could do to improve it, please let us know. Feedback is always welcome.